Three things that will help out with your joint and hip stability. One is a hip hike. Two is trunk rotation. And the third one is internal hip rotation. The hip hike is executed by laying on your back and pulling your hip up to your rib cage. Another good trunk and lower back exercise is trunk rotation. You're lifting or rotating your pelvis, lifting your hip off of the floor. You're trying to apply pressure into the wall. And then the third is internal hip rotation. You're taking your upper thigh and you're trying to internally rotate it, or at the hip joint, you're trying to move it inward. So a version of hip hike, you can go on your stomach, pulling your hip up to your rib cage, or you can lay on your side, pulling your hip up towards your ribs, getting your obliques to contract and your lats to shorten. An advanced version is standing, trying to pull your hip up towards your ribs, and this is loaded. Then we go into trunk rotation. You can lay down and push your legs into the wall. You can lay on your stomach, rotate, and push both legs into the wall, and then apply force, contracting your trunk rotators. Then another version of trunk rotation is a seated trunk isometric. So you can tie something off and pull and hold. And then also we have dynamic movements, which is loading your spinal rotators and also incorporating your shoulder. And then we have a full body trunk rotation, getting your legs, your hip, your lower back, and your arms all involved into a movement. And finally, the versions of internal hip rotation. So this is a single leg. You're rotating your leg away from your body, or internally rotating your hip. This is two legs, rotating, pushing into a door jamb. Or you can lay down and rotate your thigh internally into a wall, or you can do it standing, again applying force into the wall. And then finally, dynamic strength or high resistance, you can do bands or cables by pulling them away.